Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We're not associated with any MRCP examination organizations, and the materials covered are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on Salmonella Typhi under the section of infectious diseases. So this is a picture of Salmonella Typhi. It is unlikely that in MRCP exam they'll be asking you to identify this. However, they are within their rights to provide you with these slides as part of your written part 2 exam. So I would be quite cautious of having a general idea of what these different bacteria may look like under the microscope. The epidemiology of Salmonella typhi is that it is particularly troublesome in tropical and subtropical distribution. It affects about 11 to 20 million cases globally annually, and it's due to water and food contamination as asymptomatic carriers. This is also a reference to Typhoid Mary, which is what this poster is depicting, which was an asymptomatic carrier who infected about 51 to 122 people at the time, and she was a cook. The pathophysiology of Salmonella typhi is that it is a gram-negative facultative anaerobic bacterium which belongs to the Enterobacteriaceae family. It causes typhoid fever, which is a disease that you're probably familiar with already, and the transmission is primarily via fecal-oral route. It has a complex surface antigen which helps to evade host immune response. And it also inhibits phagocytosis, which is how it makes its way through the body and continues to infect. The clinical manifestation is really quite initially non-specific and just constitutional. This includes fever, sweating, fatigue, malaise, anorexia, and headache. However, it increases in severity with having higher fevers, GI discomfort, abdominal pain, and also constipation and diarrhea. One thing that is really quite specific and is pathognomonic, especially as far as the MRCP exam is concerned, is the presence of rosy spots, which is highly suggestive on the skin of having Salmonella typhi. It can lead to intestinal hemorrhage, perforation, and dissemination, which as a result of that can lead to hepatosplenomegaly, meningitis, and osteomyelitis. So as you can see, it can really affect pretty much any organ system in the body, and it's something that, like many other infectious diseases, starts by having non-specific constitutional symptoms, and then it will lead to quite significant and nasty complications. So this is a classic picture of rosy spots that are relatively small, almost erythematous looking circular patches of skin that you can see on the front of the chest of this gentleman. That is really quite classic for infection of Salmonella typhi. The management is with oral fluoroquinolones or intravenous ceftriaxone. Treatment is usually complicated, unfortunately, by the emergence of resistance. Your general measure in these patients, such as hydration, nutrition, and monitoring for complication, remains the key. Vaccination is recommended for those people who are traveling to high-risk area. So this would also potentially make a really nice station 5 for somebody who would be wanting to travel and is going to a high-risk area, and then you would need to be counseling them about this potential infection. Let's do some questions. Question 1. A 25-year-old female presents to the clinic with a 1-week history of fever, abdominal pain, and diarrhea. She recently returned from a trip to Southeast Asia. Blood cultures are taken, which grow Salmonella typhi. Considering the regional antibiotic resistance patterns, which of the following would be the most appropriate initial antibiotic therapy? A. Oral ciprofloxacin, B. Intravenous ceftriaxone, C. Oral amoxicillin, D. Oral azithromycin, E. Intravenous vancomycin. And if you recall, we discussed that the options for treatment of Salmonella typhi at the beginning is either with oral fluoroquinolones or intravenous ceftriaxone. Therefore, the correct option among these will be option B, which is intravenous ceftriaxone. Thanks for listening to this episode of Bite Size MRCP. If you like what you heard today, give us a thumbs up and hit the like and subscribe button to make sure that you don't miss out on our next episode. Let us know in the comments which topics you would like to hear in the future. See you in the next episode.